Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. And this is where we talk about musculoskeletal pain. Call the program right now and get your free book, 866-870-5752. The book is Dr. Darrow's latest, called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, and the foreword is written by Suzanne Summers. And would you like to talk to James in Claremont?
I would. James, Dr. Marc Darrow, how are you today?
Doctor, I appreciate your book. I received it recently, and
good.
I'll be making an appointment for my knees. Okay. And I just wanted to say, I know that you can work on my body and make a shout out for Anita. When I first met her on the radio, I thought she was related to Richie, the former. But and I found out later she's not. But you do my body, and she does my brain.
Absolutely. Wonderful.
I'm in.
Yeah. Tell me how long your knees have bothered you for, James.
Well, I had a football injury years ago, and although it's funny, it's the other knee that bothers me the most.
Okay.
So I'm going to come in and you can do your thing on me.
What's your age?
57.
Okay, so you've had 30, 40 years of pain in your knees?
No, it's I haven't really had a lot of pain, but recently going up and down stairs has affected the knees.
The main reason that people have pain up and down stairs, the main reason, not the only, because the knees are complex, is what we call patellofemoral syndrome, where the patella, which is the bone in front of the knee, and it fits in a groove called the trochlear groove in the femur, which is the upper leg bone, is kind of worn down a little bit. There's another part of that syndrome, if that's what it is, we call it the theater sign. So when you go to a movie, not that people are doing that right now, but sitting on an airplane, wherever you're kind of cramped up, the knees start to ache a little bit. And it's usually something pretty easy to fix, especially yours doesn't sound too bad. So I
don't have much pain, like you said, while sitting and so forth. But I notice sometimes getting up from sleeping at night, the knees will be a little swollen.
Okay. Well, I'd love to see you. I appreciate you calling. Have you been to a doctor about it?
No.
Okay. So we'll take a look at it, examine it, and if I think it's worthy, we might get an X-ray or an MRI to see what's going on there.
Okay.
I'll look with my ultrasound also.
Okay, one comment on your book there. Looking at the picture from Thanksgiving, that's quite a clan that you have there with the family.
Oh, yeah. It keeps growing, too. Yeah, here's the picture. I'm showing it to the camera right now.
Yeah, that's quite a picture. That takes up almost the entire picture itself. Everybody there. That's great.
We have our family is from Chicago, and I'm going to guess there's 1,000 of us. It's a giant family.
Is that right? Wow.
Oh, it's just we used to have a cousins club when I was a little kid, and my parents would rent out a big hall because there were so many people that would show up. It was so much fun. I had so many cousins and uncles and aunts and you name it. So life was good.
Even though Anita is not related to Richie, maybe every once in a while she can sing a little bit.
Yeah,
absolutely.
We're gonna go to Tom right now, James. I appreciate your call.
Yeah, thanks for your call, James. Take good care. And you want to give the phone number out real quick before we pick up Tom?
Yeah, 866-870-5752. Please call me right now. I want to talk to you and find out about your musculoskeletal complaints, arthritis, neck pain, back pain, anywhere around the body. So the number again is 866-870-5752. Tom, you also have a knee issue. How long have you had it for?
Oh, probably about 15 years.
Okay. And how old are you, sir?
75.
Okay, so you're a young guy. And are you an athlete, or were you an athlete?
I used to be, but I haven't been since this knee problem. But I have been able to learn how to walk again. Well,
okay.
Because I did see you about 10 years ago, and I think I was your patient 0 for stem cells. I was your number 1 first patient, and then
wow.
you became the greatest expert. But one thing you told me to do was lose 40 pounds, which I was very disobedient in and didn't do that.
Okay.
So now I have lost about 25 of it, and
Wonderful.
I've learned to walk well with it. But I do have problems going upstairs.
Okay.
And you were saying earlier that one of the things you asked people to do is not go upstairs. But I thought that I should be able to go upstairs again. Don't you think?
No, I'm talking about you don't go upstairs during the treatment. Let it heal.
I see. Okay.
After you're healed, go run up and down stairs all you want. Good point.
Good. Well, I'd like
point.
to get healed again, so I think maybe I should make an appointment with your office.
Okay. Well, the number to the office you can call there right now is 800-300-9300. You can call now and someone will pick up, or just leave your phone number. They'll get right back to you.
800-300, and what's the last 4 digits?
9300. 800-300-9300. Right. Okay. So let me say one thing before you run. Ha, that's a pun, Nita. You're supposed to laugh.
Yeah.
Ha.
Oh, you can do better than that. So every pound in excess on your body is about 5 pounds extra pressure on your knee biomechanically. So if you were 40 pounds,
that's why I'm doing
a
lot better without the 30 pounds. I'd like to get rid of that.
If you were 40 pounds in excess, 40 times 5 is an extra 200 pounds. So if you weighed 200 pounds, then you got about 400 pounds of pressure on your knee. And people cause their own arthritis by being overweight. That's been shown. So I have everybody go on a ketogenic diet. Those that will, most do. And believe it or not, I give them everybody gets my cell number, and I have people text me every morning when they wake up after they weigh themselves, so they can be accountable to me. It keeps them on track. I've had people lose 100 pounds doing this.
Wow. Well, like I said, I've got 10 more pounds to go, and I'll be making an appointment soon. Okay?
Yeah. God bless you, Tom. I appreciate your call.
Thank you.
Yeah, thank you, Tom, for your call. Do you want to talk to Nick?
I do, Nick. This is Dr. Marc Darrow. I understand that your back and your hip bother you. Let's go to your hip first. Tell me about it.
Yes, doctor. Hello. I have 3 herniated discs, a slip disc, and a tear in my L4, L5.
Okay.
Back pain and hip pain in both hips.
Okay.
I've lost 70 pounds. I'm in real good shape. Work out 4 days a week.
Good.
Strengthen the core, and that's helped me with the back. But that back pain and hip pain, and I ride horses and sitting on that saddle. It causes a lot of pain.
Sure.
I wonder if you can help me out.
Well, I can't tell you right now over the radio, but normally those things we can help. It sounds like you're already very active, so you're not that terrible. And I'd have to examine you like I tell everybody. I got to get my hands on the areas that bother you. Can you turn your radio off, Nick, so it doesn't reverb back into my ear? Thank you.
Turn your radio off. Yeah, I'm having a hard time hearing you.
Yeah, your radio is on. It's reverbing.
Okay, there we go.
Thank you so much. So I have to examine you. The herniated discs are not really an issue unless you have radiating pain down your neck down your arms or legs. All the things you have are pretty normal to an active person. Okay, so I don't get all alarmed and send you to a surgeon for the things you have, because I don't think that's necessary. I think that using platelets and or stem cells from your own blood, PRP or bone marrow, can help you in healing. So I have to see you. Have you been to a doc? Yeah, you must be if you know you have herniated discs. What did your doctor tell you?
I chose to exercise and work out and and strengthen my core instead of do surgery on the back and the hip. I've had MRIs and it shows a little arthritis. But that's about it. And they just tell me I have to deal with it, or
well, they tell you have to deal with it because they don't know what to do to heal it. And surgery is definitely not the answer for you because you're active already.
They don't recommend. I've got a lot of flexibility. I stretch every day for an hour, so I've got a lot of flexibility in the hips.
Good.
The pain is just. I have to do my own deep massage on my hips, or I can't do it very well.
Yeah, I got it. Well, look, riding horses is not easy. And it does keep stretching out the hip capsule. Even if you didn't have arthritis, you can have problems with the hips. So I rode horses very heavily for 1 year when I was in my internship in Denver. And I would get sore hips, I'd get sore knees. It wasn't a problem, but they'd get sore from riding. And a lot of people come in with these things that they're ready to have surgery for. And then sometimes they just stop the activity and they get better. But obviously no one wants to stop their activity. So we generally...
I'm having a hard time hearing you.
Okay. Can you turn the radio back on, and we're going to take you off of the air and you can listen to what I'm going to say. Okay?
Thank you, Nick.
Okay.
So for Nick, the answer is most likely to get some PRP or some bone marrow with stem cells in his hips and maybe his low back to help regrow some of the tissue that's been worn out by his activities. And all of us, as we age, dry up a bit. People get shorter, the discs in the low back or in the neck, and actually the whole spine starts to dry out a little bit, and we get a little bit shorter. And it's so weird to see people like my dad was about 6'1" when he was young. And I don't remember how tall he was before he left the planet, but he was a lot shorter than me. And he died when he was 90. So that's very common. And it's common to have a lot of pain in your body if you're super active as you age. When we're younger, we have a lot of extra tissue that we don't get beat up as much. But as we get older, people always say, I don't heal as fast. Well, that's true. All the systems in the body as we age start to slow down a little bit. So sometimes it's good to replenish hormones in the body, testosterone for men, and for women, estrogen, progesterone, testosterone, to keep things working the same way. There's a lot of things that could be done. I think the most important things that we can do are be on a ketogenic diet, which is basically low carb, and keep active. I think I told this story on the radio before, Anita, but I was running up my mountain here where I live with my husky, Bella, and we came upon a shrunken up little couple, and very gregarious, so I stopped them, and I said, how old are you guys? And the woman took over the conversation, said, well, I'm 90 and he's 92. And both of them had this message for me, and they repeated it over and over. They said, keep active. I kept saying, you guys hike up here? And they go, every day, a few hours a day. And they kept saying, be active and you'll stay young. So that's my motto always. It's always been like that. I've always been seeking Ponce de Leon. Do you remember him, Nita?
Oh, yes. He was, he had a couple boats or a ship or something. Didn't he travel the ocean blue or something?
He did. He traveled the ocean blue. And he came from Spain to America, and he was looking for what? The fountain of youth.
Ah, yes.
And I read about him when I was a little guy, and I've always been searching for the fountain of youth. And I have youth inside of me. I always tell people when they ask me how old I am, I say I'm 16, and they laugh. And I think the key to life is keep searching for youth, joy, happiness, and all of those things, and just living from your heart the best way you can, because everything's inside. All the good stuff is inside. The world has gravity and decay, and we have to live in it, but we have to regenerate. I meditate 1 hour every day. Okay, so I'm about to do that after the show.
It's all in our attitude, isn't it?
Pretty much, and attitude is something we can generate. It's a choice in every moment. So something happens you don't like, you go inside and you clear it, and you go, I like it. It gives me something. It might be a lesson. There's always something good out of everything. So I'm going to take some questions here, if you don't mind, Nita. I'm going to mention something else. We do something called...
Do you want to give the phone number first?
Absolutely. The phone number to the studio right now, you want to talk to me, we've still got a few minutes left, 866-870-5752. Grab your pencil, 866-870-5752. And another number to my office, if you catch us live and hear the show another time, is 800-300-9300. You call and we will get right back to you. That's 800-300-9300. So let's go to some questions till we get some callers.
Okay.
Let's see here. This one says 90 years old, do not want surgery or cortisone. That's a smart guy or woman. This person says, I have had 2 cortisone injections that did nothing. That's good news. X-ray indicates right side of knee is bone on bone. That could be good news because I rarely ever really see a bone on bone. I see every doctor saying it's bone on bone, and then when I examine the person, I can move them around, and it's not bone on bone. Bone on bone is a seduction to get surgery, to have a joint replacement. It's not real in most cases. It could be real, but I rarely ever see bone on bone. Bone on bone to me means the joint is fused, it will not move. Person says, I'm 90 years old and do not want surgery. Well, being 90 years old and having a surgery, it leads to disaster, okay? A lot of the systems are shut down. There's more infections, more problems, more pneumonias, and less healing. So surgery is not the answer for a 90-year-old unless it's an emergency. Pain is constant both at rest and in motion. Interest in PRP or stem cell treatment. So the big key to what this person wrote is the word motion. Okay? If they're in motion, they're doing pretty good. And usually regenerative medicine using bone marrow for the stem cells and platelets, or just platelets from the blood, is going to be the answer to help them. Does it mean they're going to heal? No, I can't predict. I always tell people there's no guarantees. But most of the people that I treat are pretty happy. If they don't get completely better, if they get a little bit better, they're happy.
Would you like to talk to Chandler in Huntington Beach?
Yes. Chandler, are you on the Friends show on TV?
Sure, yes. Yeah, I got today I'm getting an MRI in my left knee.
Yeah.
My meniscus.
Yeah.
And it's swollen in the back. And I'm just wondering, what do I do after the MRI?
Well, I don't need your MRI to treat you, but you can certainly bring it in and I'll take a look at it with you. The fact that you said meniscus and swelling in the back does not really medically impress me because that's not a big deal necessarily. And there's still hope that you could heal. And I certainly wouldn't jump into a surgery, which has a high risk of failure and terrible sequelae. I don't know if you know my story. I had a shoulder surgery when I was in medical school that completely ruined my shoulder, and I was miserable for a few years until I learned about regenerative medicine. I injected myself, and my shoulder healed the next morning. And it doesn't always work like that. I'm just telling you my story. It was pretty miraculous, but it's not like that for everybody. Sometimes we need several treatments to get better. So if you want to come in and bring your MRI with you, 800-300-9300 is the office number. I'll repeat it. It's 800-300-9300. And I'd love to examine your knee. The fact that there's swelling in the back may mean that there's what's called a popliteal cyst. or a Baker cyst. And if you want that aspirated or drained, you make sure that that doctor uses an ultrasound. It's a very dangerous thing to aspirate because there's the nerve that goes to the bottom of the leg that could be tweaked and you could lose your leg. And you could actually die from it. There's a major artery back there. So never a needle in the back of the knee without ultrasound guidance, okay?
Okay, doctor, yes, thank you.
And the other thing is typically when someone has a popliteal cyst, that's fluid in the back of the knee, it's not a problem in the back of the knee, it's a problem in the front of the knee. And the front of the knee, when it builds up with fluid has nowhere to go, so it pops into the back, okay? So when someone has popliteal...
They drained fluid off my knee before.
Okay. So the goal for you is to treat the front of the knee, and when that starts healing, the knee will not produce fluid anymore. Okay? So the fact that you're still blowing up with fluid indicates your knee still needs some work to regrow the tissue. Just draining it does no good at all.
Okay.
It's just going to come back.
Okay, thank you.
God bless you, Chandler. There's good hope for you.
And our number is 866-870-5752 right here in the studio. And here's Valerie in Sun Valley.
Hey, Valerie, Dr. Marc Darrow, I understand you have a swollen joint in your fingers. How many fingers are swollen?
I do, Dr. Darrow. I'm noticing it mainly on my pointer fingers on both hands.
Okay.
And I'm starting to notice a little bit of swelling on the other fingers also. Okay.
And have you been to a doctor about it? Do they do an x-ray? Do they do any blood tests?
No.
Okay. There's no deformity, it's just a little swelling?
There's a little bit of deformity on the pointer fingers.
Okay.
On the joint closest to the fingernail.
Yep. So I'd have to look at it and see what's going on. What's your age, Valerie?
I'll be 75, Dr. Darrow, in a couple months. Yikes.
Congratulations. Happy birthday.
Thank you.
Most likely we would just inject those joints and stabilize them and get rid of the swelling. And
okay.
I'm not a big believer in cortisone because it literally destroys the tissue. It feels good for a while. It's a great anti-inflammatory. But long term, I think it's a bad thing. I think it causes problems. So I wouldn't do that. And I have one story that I tell every once in a while about a woman who was a tennis player come in, and she had tennis elbow, and she had so many cortisone injections in her lateral epicondyle that the tendon, the extensor tendon, was worn down to nothing. She could barely even extend her wrist backwards. And I had to inject her many, many, many times to regrow that tissue. And she's back at playing tennis now, so she's happy, but it took a lot of work.
Oh, Dr. Darrow, quick question. Does the injection that reduces the swelling, does it prevent further swelling or?
No, generally it doesn't create more swelling, but it'll create a little bit of stiffness for a day or so.
Okay. But does it prevent it from occurring again, or?
That's the goal. I can't promise you one thing.
Okay.
You know, we all know that there's two things that are promised in life. You know what they are? Death and taxes. Hey, Irving, we can't get you, but you can email me through the website at www.lastemcells.com. That's www.lastemcells.com. There's a spot on every page to email me, and I will get back to you probably the same day. Or you can call the office at 800-300-9300. Thank you, Anita Valens. You're a great host. Thank you, Alex and Suzette and the rest of the staff. God bless you all, and God bless the world.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.